So the question is, which one of the following are the risk factors for wound infection? So risk factor for the wound infections will be the one when the bacterial contamination will be more than the host defense mechanism. So if we see the first option is the malnutrition. So what does malnutrition lead to? Malnutrition lead to decreased collagen synthesis, decreased fibroblast proliferation, decreased cell-mediated immunity, and decreased WBC function. So malnutrition is a risk factor, and most importantly, the hypoalbuminemia is associated with the post-operative surgical site infection. If we see the second option, so first option is correct. If we see the second option, the poor perfusion. So adequate blood supply is essential for. So the blood supply is essential for oxygen delivery, neutrophil function, nutrition, nutrient supply, and antibiotic penetration. And that's why poor perfusion occurs in diabetes mellitus, peripheral arterial disease, shock, smoking, and hypotension. And this all leads to poor wound healing. Poor wound healing plus increased infection. Most importantly, the neutrophil oxidative killing is oxygen dependent. So for that, the perfusion is important, dependent. So if we see the second option too, the second option is also correct. So first is correct, second is correct. If we see the antibodies, so the antibodies are the part of the normal immune defense, and they are required for opsonization, second neutralization of pathogens, and complement activation. So they are rather protective. So if we certain conditions like hypogammaglobulinemia, immunodeficiency, or neutropenia, they all leads to wound infection. So third option is incorrect. Now the foreign body material. So foreign body material increases the risk because they harbor bacteria. They promote formation of biofilm. Biofilm formation occur. They prevent phagocytosis, and they reduce effectiveness of antibiotic. For examples like sutures, prosthetic implants, dirt or debris, or necrotic tissue. They all increase risk of wound infection. So the fourth option is also correct. So the correct option will be 1, 2 and 4. So B is correct.